You are at the webinar Alberta is not an island, Bill 11, and the attack on Medicare. This is hosted by the Council of Canadians and the Canadian Health Coalition. So my name is Nick Barry Shaw. I'm the trade and privatization campaigner with the Council of Canadians. Still have lots of people coming in. Maybe you hear my computer dinging. I apologize for that. But glad to see so many people coming out for this. I think it's a really important discussion. I just wanted to start by saying that I'm joining you from Montreal, which is unceded Mohawk territory. It's also a gathering place for Huron-Wendat people and Algonquin peoples. And so as people are arriving, I would invite you to go into the chat if you want, and just say where you're calling in from. Sometimes what people do is also put their name, their city in their name, because we will at the end of the webinar have a chance to connect with local organizers. So knowing which city people are calling in from can be useful. So I'm going to encourage you to do that. You can go click on the little three blue dots in the top corner and just add the city that you're calling in from with your name. So I'm going to pass it over to Anne Lagacé-Dowson from the CHC in a second. I just wanted to introduce the Council of Canadians for people who may not be familiar. The Council was founded in 1985 in the crucible of the fight against free trade with the US. Certainly in the last months and years, we've been telling a lot of people, we told you so. We had been warning for a long time about the dangers of deeper integration with the US and the consequences it would have for our economy, for our environment, for inequality in our society, and for our healthcare system. And so defending public healthcare has always been a really key part of what the Council of Canadians does. And we're really proud to be co-hosting this webinar with the Canadian Health Coalition at a critical time where I would say public healthcare in Canada, both in Alberta and across the country, is under attack as never before. And so I'm glad we're here to talk about what's happening with Alberta's Bill 11 and what it means for everyone across the country. And so with that, I'll pass it over to Anne Lagacé-Dowson from the CHC and let her introduce.
Hi everybody, bonsoir et bienvenue. Je suis Anne Lagacé-Dowson de la Coalition canadienne de la santé. Cette réunion et rencontre se déroulera en anglais. Je vous parle de Tiohtià:ke, Montréal, le territoire non cédé des Mohawks ou les Kanien'kehá:ka des Six Nations. And I just wanted to welcome everybody to this meeting. It's not a webinar per se, but it's like a webinar, and we're super happy that there's so many people with us. It's absolutely great. Just wanted to explain that the title is Alberta is not an island, based on something that the MLA for Calgary, Matt Jones, said in a speech where he talked about promising to open up Alberta to two-tier or public-private healthcare. So this guy is not our friend. Let's basically say that. I'm Anne Lagacé-Dowson, the comms director of the Canadian Health Coalition, founded in 1979, so a little earlier than the council, by, among others, T.C. Douglas or Tommy Douglas and others to protect and universal public health care. The coalition was also instrumental in pushing for the passage of the Canada Health Act in 1984. And we continue to work on the healthcare file at the national level with frontline healthcare workers, unions, researchers, civil society groups, students, and individuals. And so we'll put a little bit of information about the Canadian Health Coalition in the chat, hopefully at some point. We also created a landing page for the Day of Action, which is planned for Monday, in front of the offices of various members of Parliament, including the Federal Minister of Health, at noon. So if you just Google Canadian Health Coalition Day of Action, the list of actions will appear on this landing page. The Ontario Health Coalition has also done a great job of enumerating who's doing what, so you can go and find out what's actually planned. And we encourage you, if you have the energy to do a last-minute plan, go and stand in front of your Liberal MP's office with a sign saying protect healthcare from Bill 11, or whatever you think you can do spontaneously at the last minute, because this is a big, big question, as you're going to find out from our speakers. So tonight's webinar will feature two great and knowledgeable speakers in the lead up to our Day of Action. And we're also going to take questions, and then we're going to go into breakout rooms at around 7:45 for those people who want to know more or would be interested in what the health coalitions and other groups are doing in their respective provinces and territories. And our two speakers tonight are the head of the Friends of Medicare, Chris Gallaway. The Friends of Medicare, basically the health coalition in Alberta at ground zero of this fight. And we're also lucky enough to have with us Andrew Longhurst, who is a health policy researcher with the Canadian Centre for Policy Alternatives. So I'm going to start with you, Andy. You co-authored a report that says Bill 11 could mean the end of universal public health care, also known as Medicare, as we know it. And what do you mean? And how can a bill in Alberta mean potentially the end of health care?
Thanks, Anne, for the question, and it's so great to be with all of you. It is a real pleasure to be doing this work with Chris and Anne and Tracy and Nick. Thank you also for being part of this important conversation, tuning in. So Bill 11 is probably, I think it is not probably, I should say, it is certainly the greatest threat to Canadian public health care that we've seen since its inception across the country. And what it does is it creates what's called dual physician practice. This means that doctors and surgeons can work in the private pay system, charging patients for services like routine consultations, surgeries, other basic health services that we at this point in time expect to walk into the clinic or the hospital and come out without a bill in our hand. It also at the same time allows doctors and surgeons to bill the public health insurance plan for the same services. And so what is so unique and so alarming about this development is this is has never happened in Canada before. We have never seen a province open the door to this model of dual physician practice, which is the mechanism or the method by which two-tier healthcare is established and will be established in the province of Alberta. Now, back to Anne's question, why is this something that is a risk and a massive threat to the rest of the country? It's because this approach is likely, if not contained and not dealt with directly and firmly by the federal government and voters in the province of Alberta, is likely to spread to other provinces and become a much bigger threat to the very foundation of public Medicare in this country, which is based on need and not ability to pay. And so very specifically, just to get into some of the nuts and bolts of what the legislation does, it allows, like I said, doctors to decide whether on a case-by-case basis what they're going to be providing to you is going to be covered under the public plan, the public provincial health insurance plan at no cost to you, or whether what that procedure or intervention is going to be something that requires you to pay out of pocket, either with your own credit card or with private health insurance. And that brings me to probably the greatest threat in this legislation, which is it opens the door for a private health insurance market for medically necessary care that's covered under the Canada Health Act. And this is what makes it such a direct and unequivocal threat to the foundations of public health care in this country, because it is a direct assault on the Canada Health Act. And opening up that private health insurance market is something that we have not seen anywhere in this country for covering anything from a consultation with a surgeon to a surgery. Right now, the legislation itself is written in an extremely open-ended way, which means that it could be extended to family doctors. It could be extended to surgeons. It could be extended across surgical and medical specialties. The government has said that they are going to be limiting this legislation to some specific surgeries. But as it stands now, the legislation is entirely silent on constraining this two-tier system to specific surgeries or specialties. It is open-ended, and they're saying we're going to be passing regulations that accompany the legislation, and we're going to be limiting it in those regulations. But what's really important to note is that when you have regulations, those can be changed by cabinet, and they don't require the legislature of Alberta to have a sitting to pass those changes. So really, the two-tier system in Alberta, as it's written in the legislation, is open-ended, and it welcomes a private health insurance market that is already eager and has been involved in the development and the implementation of Bill 11, and that's been clear from the public record. So I think the last thing I would want to say on this note is what we know in Alberta and what we know already with its use of private for-profit surgeries, so using public dollars to outsource surgeries to private investor-owned facilities, has already increased wait times for 9 out of 12 priority procedures in the province. And this is research that I've done over the last number of years. And so we have already seen the impact of greater investor and for-profit involvement. And so this is yet another much more concerning development, which is now using the legislation to open the door for a private health insurance market where, like the US, if you can afford it, you may purchase private health insurance or be encouraged to for that preferential access. But we know that private health insurance is beyond the reach of many. We know that in the US, for example, unpaid medical debt is the greatest source of personal bankruptcy. This is not a model and not an industry that we want to be welcoming into our country. And it strikes at the very heart of what Canadian sovereignty means and what it should mean for this federal government. And I think I'll leave it there, Anne. Thank you.
You're
There are a
just
couple of
muted
things
there.
I want to come back to with regard to, among other things, the Canada Health Act, which we'd want to activate. But I just wanted to ask you, Andy, and quickly. So Danielle Smith has said, well, they already have this in Quebec. We have this in other healthcare countries. It's not that big a deal. Like you guys are freaking out about nothing. In fact, she accused you of using NDP talking points, Andy. So I wonder if you could just give us a quick comment on how it differentiates itself, how it's different from what's already in place in places like Quebec.
Yeah,
Thanks.
so first of all, the Alberta government has said that this is just like what's done in New Brunswick and Quebec. Those are the two provinces they used. We had a very intrepid journalist based out of Medicine Hat who followed up with the New Brunswick Ministry of Health and said, do you allow this model of dual physician practice and two-tier healthcare? And the health ministry in New Brunswick said, no. And we also know in Quebec that this is not the model that's allowed. What exists in Quebec is like much of the rest of the country is physicians have to decide whether they're going to bill the public insurance plan in your province or whether they're going to work in the private pay market, charging for services based on whatever the market will bear. But they have to make a decision whether they're in the public system or they're out. And this is the key distinction with what this bill does in Alberta is it removes the requirement that physicians and surgeons make that decision to decide whether you're in the public system or not. And it takes away the financial risk for physicians and surgeons and the private for-profit facilities they may work in by allowing them to work simultaneously in the private pay system and the publicly funded system. And that's what makes it distinct from everything across the country. It's also distinct to your question around, isn't this European healthcare? Well, there's also a lot of countries in Europe. Europe, last I checked, is not a country. So it's important to keep in mind that there are many distinct health systems across Europe. And a number of the countries that the Alberta government likens this model to, its model to in Western Europe as well as Australia, do not exist. It is not the case that it is the same. So what we see in a lot of those Western European countries is we actually see a highly regulated system. They tend to be called social health insurance models, where you have employer and employee contributions to funding or paying for the health system. And it's a distinct way of funding healthcare compared to Canada. But what we see in many of those jurisdictions is a much different way of regulating insurance. And so a lot of those insurers, in fact, are actually essentially nonprofit or public insurers because the system is so highly regulated. It is also the case that many doctors and surgeons in the jurisdictions that the Alberta government references have salaried employment with the hospitals they work in, which means that the public system has control and contractual constraints on their ability to spend time in a private pay system. And so when the Alberta government makes a lot of comparisons to those jurisdictions, it's simply not accurate because it doesn't reflect the complexity of those systems and also the high level of regulation that maintains universal access in those Western European health systems. And I can talk a little bit more about Australia, which is certainly a cautionary tale, but I'll pass it back over to you, Anne.
Okay, thank you very much, Andy. That is super helpful and incisive and succinct because it's, people are, oh, healthcare, it's so complicated, and you just made it very understandable and not complicated. So thank you so much for that. And now we're going to turn things over to Chris Gallaway of the Friends of Medicare in Alberta. And, I think, what did they say? Oh, they said Friends of Medicare, Danielle Smith government said that the work you do is biased and unreliable, Chris. So we're going to try and do an end run around that. I think you have them on their back foot, if anything, in Alberta. Anyway, Chris, let's just start with you've said that Bill 11 is basically an insurance bill. And by that, can you just sort of elaborate a bit on that? What does that mean?
Absolutely. And, as Anne said, I'm from Friends of Medicare, which was also formed in 1979, in case we're keeping score on years in this meeting tonight for some reason. So happy to be here with all of you. But yeah, when we talk about Bill 11, which is now passed, so it's actually a law, but we refer to it as Bill 11 still. It's easier than the Health Statutes Amendment Act number 2, 2025, or whatever name they gave their omnibus bill. But that legislation is often talked about as a healthcare bill, but what it really is, and as Andy was talking about, is an insurance bill. It's a gift to the insurance industry, is what we've been saying. When you look at the Canadian Life and Health Insurance Association, who is bragging about this legislation, they see it as a great opportunity for the insurance industry, that they've been at the table with the government in a working group talking about how to do this. They really see it as a big win for private health insurance, which to us means we should all say that cannot possibly be a big win for Albertans if they're this happy about it. And so what the legislation does, and we talked about it a bit already, is allows for the selling of insurance for medically necessary care that's already covered under the public healthcare system. It allows workplace plans to start adding those products to your health and dental plans if you have those through employment or in other ways. So it's really setting up this market for insurance companies. And on that fact, this didn't come out of nowhere. This has been a multi-year project of our government to dismantle the healthcare system and privatize it. They've used public funds to help fund things like private surgical centers to set up the markets to then flip the switch to a two-tier system. So it's been methodical. It's been happening for years. People in other provinces should look to what happened here because a lot of other governments are doing similar steps that led us to this point. And just on this, and folks from the Council of Canadians will know this, but one of our big concerns around the insurance industry is that if we allow the American health insurance companies into Alberta to sell these products, right now we have protections for single payer public health care in our trade agreements with the US and elsewhere. But if we willingly let these companies in to start operating in Canada, are we foregoing those protections? And then they're everywhere. It's Alberta's opening the door, but they're in Canada. They're selling products. They're massive lobby that spends millions and millions of dollars on lobbying and influencing governments and influencing healthcare systems will be in our country. So we see this as an existential threat, a real existential moment for Canadian healthcare, and especially in terms of what it means for the insurance industry in this legislation.
So you've been on the road organizing town halls across the province in places where
Mhm.
historically there hasn't appeared to be much interest in healthcare. Can you tell us a little bit about what that's been like being out on the road like that?
Yeah, we've already had 14 public town halls across the province from down in Lethbridge and Medicine Hat all the way up to Fort McMurray. And in between, we have four more scheduled this month. They're on our website and more to come. And people are coming out in big numbers in places that we've not been in years or potentially never been to because they're worried about healthcare in their community. They don't trust the government on what they're doing, but they also realize, especially the more rural and remote communities, that if we go down a road of two-tier American style healthcare, they will not have healthcare services in their community because the profitable air quote services to run will be in the big cities, in the big centers, and they'll have to travel for everything. They're not going to be able to compete for the workforce and so on if we go down a model that's dominated by who can pay or where the insurance industry wants people to go for their care. And so they really get that in a way, in spite of how those places may have voted or what the politics look like at the community level, at the municipal government level, at the health foundations, and so on in those communities. They really get that this is a scary moment for them, that they're already experiencing service losses, closures, temporary closures, a lack of doctors, and so on, and that this will only make it worse. And they're very worried. So they're showing up in big numbers. They're signing up. They're starting new chapters of Friends of Medicare to do work in their community because they're very worried about what this means. So it's exciting to actually get out there and talk to real people in their community to hear their stories and to get them activated to push back on this. So yeah, it's been a really good experience with more to come. So anyone who's in Alberta should come if there's one in their community because there's more coming up.
Just to mention, we're going to go into breakout rooms that'll be organized according to province. So that will be the opportunity for those people who are with us in Alberta to get together with people with Friends of Medicare in the breakout room for Alberta. And there'll be one for Ontario. Natalie Mara, the coordinator director of the Ontario Health Coalition, will be on the Ontario breakout group. So it'll be a chance to meet and, exchange information and hopefully form some new groups and contacts. And once again, I'll just mention on Monday there are I think it's 14 now actions planned in front of the offices of Liberal MPs in Edmonton, in Calgary, in Montreal. We're going to go and stand out in front of the Federal Minister of Health's office on the Trans-Canada Highway, the very friendly place that she located her riding office. And there are numbers of actions in Ontario as well. So we're trying to get the word out to the elected people in Ottawa that this is no good and we do not approve of this. And then there's any number of other actions people can take, including if you can't go to a little demo, you can certainly call your MP, write a letter, and then if you look in the chat, there's some organizational suggestions for you to follow up on as well. So the fight has just started. We'll probably do another day of action before too long, and hopefully we'll hit more MPs' offices, and then you can do the demo and then go off and have some fun with your friends after for lunch. That's what we're planning. So it doesn't all have to be serious. Activism can also be fun. I'd like to bring you both back on to talk about the Canada Health Act because I think there's a misunderstanding on the part of a lot of people about the role of the federal government and the provincial government, provincial and territorial governments with regard to healthcare. It's not simply a provincial jurisdiction. There's also a role for the feds with regard to healthcare, not just to transfer $60 billion a year from the federal government to each of the provinces, including $6 billion to Alberta, but also there's this law with 5 criteria very clearly delineated in the law. So I wonder if you could jump in on that, Andy, the role of the Canada Health Act with regard to this Bill 11 thing.
Yeah,
Yeah.
that's a great question, Anne. And what we know with Bill 11 is it really strikes at the heart of at least two of the principles of the Canada Health Act, universality and accessibility. And those conditions are intended to apply across the country. So all the Canada Health Act is the national framework to ensure that provinces have provincial health insurance plans that uphold those principles. And so when we look at the condition of accessibility, it is intended to ensure that provincial health plans provide uniform terms and conditions and on a basis that does not impede or preclude reasonable access. And what we see very clearly with Bill 11 and the dual physician practice, which is what establishes a two-tier system, we see that it is going to shift, and this is based on a large body of literature that has been built up over many decades. And we've seen experiences in Canada, we've seen experiences in Australia, in the United Kingdom, where a parallel private tier that's based on preferential access ends up shifting the workforce to that sector. So when you have a limited supply of surgeons and operating room nurses and anesthesiologists, you don't magically multiply that workforce and cut them into two when you have a two-tier system. You simply shift that system. And Dr. Braden Manns, who's a physician and academic researcher at the University of Calgary, has a very helpful way to talk about this phenomenon. He says, contrary to what the Alberta government says when we have this private option, it doesn't mean that that person comes off the public wait list. It actually means that that patient takes the whole surgical team with them. So you're not expanding, you're not duplicating the workforce. You're simply just shifting it to the private tier, which is based on a private health insurance model. It's based on out-of-pocket payments. It's based on preferential access. And that strikes at the heart of the accessibility criteria in the Canada Health Act. Also, the Canada Health Act says insured services under the Canada Health Act, physician and hospital insured services, what we count on, are to be provided with no financial barriers. And so quite clearly, again, the Canada Health Act is being violated here. So this legislation is the most direct assault that we've seen on the Canada Health Act since its inception.
Chris, did you want to add anything?
Yeah, when we were in Ottawa recently lobbying, we had a lot of questions from people saying, healthcare is a provincial thing. Why are you in Ottawa? And it's an important reminder that it has always been a federal provincial partnership in Canada. When we brought in Medicare, there's a Canada Health Act. Alberta is actually going to get over $7 billion in federal health transfers this year as our population grows. So there's absolutely a role and responsibility for the federal health minister to enforce that act, something we're calling for. But also this idea around accessibility and preferential access. I think it's important to remember that the only way there's a market for these services is if there's long wait times. Nobody will pay to get an MRI, get a surgery, or buy separate insurance to get access to those things if there isn't long wait times. If you knew you were going to get your MRI next month, you're not going to pay out of pocket to get one. So it's actually baked into this whole model that we're bringing in Alberta that we need long wait times in order for there to be markets for any of these products to exist. So when the Premier comes to us and says privatization is going to save money, bring down wait lists, and expand capacity, which she does every time she announces something in private healthcare, it never comes true. And it's because it can't, because there's no market for these things without wait times, without preferential access where there's inequity. So that it's absolutely a full-on attack on Canadian Medicare and the Canada Health Act.
So we at the Canadian Health Coalition we just met with some senior staff in the office of the federal minister after being kind of blown off several times, like not getting not getting very far in terms of our requests. And we have requested another meeting with the federal health minister, but there hasn't been a lot of interest, let's just say, in this file on the part of the federal minister. So that's why this this meeting is very important, and that's why this day of action is also important, because it's going to have to go to the streets. We're going to have to make some noise about this, and that's going to be the challenge for all of us on this meeting: is how do we bring this to the attention of the minister to make it clear to her and to Mark Carney that this healthcare issue is very important to people. And I wanted to touch on this. Like, for so many of us, healthcare is actually, it's very personal, it's very meaningful. We have family members who go into the medical system who need care, who need to be seen. And there's a deep emotional attachment to healthcare. Like, one of the things that defines Canada, like Tommy Douglas was voted the greatest Canadian by a bunch of people on the CBC. Now, it's a number of years ago, and there may be people on this call who don't really know who Tommy Douglas was, but it's very much part of the Canadian identity. And I wanted to hear from both of you about that from you, perhaps even personally too, about what healthcare signifies for so many of us. Andy, do you want to jump in?
Yeah, that's a great
Before they
question.
do
And
that, before they do
uh,
that, chat has been disabled. Is that intentional?
I don't think, oh, maybe
Sorry.
so.
The chat will come back on for the Q&A.
The
It
chat
was
will be on
announced in the.
shortly. Yeah, please bear with us. We're going to wrap up on this part of the the meeting soon. So just going to close on this emotional issue,
Yeah, that's
then
a
we'll
great
open it
question.
up.
I mean,
Yeah.
I grew up in the United States. I grew up in a fairly middle class household, but even still, with the employer sponsored private health insurance that my family had, my household had upwards of $20,000 in co-payments and premiums to just the privilege of having private health insurance. So I think this is the reality that we need to come to terms with in terms of what is at stake. We're not talking about, $5,000 here or there. We're talking about a system that is going to be completely reworked and redesigned in the interests of profit taking and corporate greed. And that's the US system in a nutshell. So we don't want that. We know that the day of action is such an important visible sign of what we're fighting for. We're fighting for public health care for everyone. We're fighting to improve our public system. And just to also highlight, I think one of the reasons we are working so hard to call on the federal government to take a strong, unequivocal stand in favor of the principles of the Canada Health Act and the Canada Health Act itself is because once we have US corporations or any foreign investment for that matter into our healthcare system, because of our international trade agreements, it will become virtually impossible to get these corporations out of the country. And so we published a recent report, Rebecca Graff McRae and myself, with the Parkland Institute and the Canadian Centre for Policy Alternatives, that was shared in the chat. I encourage you to read it. But we talk about no longer will it be US style healthcare. What we will have is US healthcare because the very corporations that exist in the for profit healthcare landscape in the United States are going to be the same foreign investment interests that are going to want a piece of the action in Canada. We hosted a recent webinar with two leading scholars on private health insurance in the private healthcare industry. And one of the most telling moments in that entire conversation with two of these leading scholars, Dr. Woolhandler and Himmelstein, was that the US insurance industry is looking for new markets. They are one of the most active players now in South America. And so it is not far-fetched. It is not it is not beyond reasonable, rational consideration to understand that this is a threat of U.S. control in Canada. And so I think we need to take this very seriously, and we need the federal government and our provincial governments to take it as seriously as that, which is our sovereignty is not up for sale through our healthcare system.
Chris?
Yeah, our premier and government might call that a hyperbolic prediction, but I think it is true of where we're headed. But a phrase they used recently. For myself, I grew up in Southeast Saskatchewan. My family's still there, and every time I drive home to visit it, I drive by the statue of Tommy Douglas that's on the highway in Weyburn, where he was the MLA. So I definitely know who Tommy Douglas is, and that history of healthcare that people are so proud of. And I'll just say, when you take away the partisanship and the political debate and actually go talk to thousands of Albertans all over the province, they support public health care. It's still a deeply held value. It's something they support. The recent polling we've seen shows that as well, where over 2/3 of Albertans don't support what the UCP government's doing on healthcare. It's become the top issue again, passing affordability of concern. People care deeply about this in spite of how they voted or may vote. They see it as a piece of the Canadian identity that they want to protect. It's a value of fairness and that we all look after each other. So I think there's a real opportunity to reach people on that frame and go talk to them and remind them that nobody in Alberta voted for this in the last election. We actually had a premier who ran for election on a public healthcare guarantee, on some wait time metrics, on fixing the problems in the public healthcare system. And then once she got her first majority government, announced the destruction of Alberta Health Services, massive restructuring, contracting out services, three large healthcare bills that have led to Bill 11 and a total structural change to two-tier private healthcare and private insurance. None of this was in a platform. None of it was debated publicly. Bill 11 was passed in 3 hours using closure at midnight, right? So they haven't actually taken this to the public. And when we're out there, it's not supported by Albertans. They don't want two-tier healthcare. So I think getting out there and talking to people and listening to people, it really shows how deeply held that is as a value. And we can really capitalize on that as we push back against these, folks who want to profit off of our health.
So we'll just open up the chat now for anybody who has a question that they would like us to address in this next 15-minute quadrant. And then after that, we're going to go to the breakout rooms. According to province, hopefully you'll be able to connect with some people, some fellow, some kin, political kin out there. And I think we have been very happy about the reaction that we've been getting on the work we're doing on this question. When we went up, the Canadian Health Coalition organizes a lobby on Parliament Hill every year. This year we had 200 people from across the country join us to go up and talk to parliamentarians. And that resulted in the question of the Canada Health Act being raised inside the Liberal caucus meeting a week ago. And I got that from a reliable insider source, because what goes on in the caucus meetings is not supposed to be known publicly. But there are a number of members of the Liberal caucus who are medical people, physicians, nurses, etc., and they are open to this. There's a number of people from Nova Scotia who support pharmacare. The Liberal caucus is a mixed bag. So we have some allies in surprising places, which was good news for us. So let me just move to the chat, I guess, with Nick alongside to try and make sure that as many questions get addressed. I'm going to start with one, Nick.
Yeah, and I'm gonna try to jump in, and when I see a good question,
Yeah,
I'll
yeah.
get it. I just want to say, please put your questions in the chat. We have 200 people in this call, which is amazing. Thrilled by the turnout, but if everyone's coming off mute, it'll take a tremendous amount of time. So please just go in the chat and write your question. That'll be the best way, and we'll try to get to as
Nice
many of
and
them as
short
possible.
if you can. So very good question here, which is, what can be done in terms of legal action, if any? We talked about the Canada Health Act, which would be something we would like the federal minister to take action on, but there's also the question about legal action. I know that there's been legal action in Ontario with the Ontario Health Coalition's fight against upscaling or upselling cataract surgery, etc. So I wonder if either of you have any thoughts on the options outside of the federal Ministry of Health. Andy and Chris, jump in.
I was just going to jump in to say we're exploring a legal opinion and where we could maybe go in terms of the legal side. And it's important, especially if we could get something like an injunction or some other tool. But if it's not that, the courts take a really long time, and we need to have a grassroots on the ground response to stop this from happening. We can't count on the courts or so on to just save us.
Yeah, and I'll very briefly add, I think there are various legal tools that could be applied. One of them, as Chris mentioned, is an injunction. Another one is a writ of mandamus, which means that we compel the federal government to enforce its own legislation. So it would be a petition from a party with standing, and it would legally compel the federal government to enforce the Canada Health Act. So there's a number of different legal strategies. These are all under consideration right now. So please know that we're all engaged and working very hard on this.
Do you want to jump in, Nick?
Yeah, I just wanted to jump in with a question from Kevin Scarrett in Ottawa. He asks, how is it possible that Prime Minister Carney and his Minister of Health have remained silent on Bill 11? Have MPs from Alberta or other governments addressed it? I think that's a really important question.
Yeah.
Yeah, so the only MP from Alberta who's spoken to this publicly or in the House so far is Heather McPherson, who's from the NDP. Which is frustrating, but that's where we're at. But it has been raised during the lobby day a couple of weeks ago. Gord Johns from the NDP, the health critic, raised this question. We also had an Alberta Senator, Chris Wells, raise this question in the Senate while we were there. So it has been brought up. During that lobby day, we did meet with MPs from every party and senators from multiple parties about this. But yeah, the health minister and Mark Carney so far have been near silent on what's happening. And that's part of why this push with the email tool and the push to get you to write to the minister and the National Day of Action on Monday are happening, because we need them to break their silence to say that this is absolutely a violation of the Canada Health Act and that they're going to do something about it.
There's also a petition that Heather McPherson put up on the House of Commons web page. You can sign. It's quite a good petition. I think there's thousands of signatures on it. Going to the larger point about how committed people are to healthcare right across party lines. So there's a very good question here from Constance Blundy, who says, "What's in this for the Alberta government? What do they think they're going to get from this? What they're clearly in thrall, or they have close relations with the insurance industry, but is there a strong risk of blowback for these guys, for the UCP government, Chris?"
Yeah, we've seen a history with this government of, I'll use the word allegations very clearly, allegations of corruption in terms of how they've awarded contracts to for-profit health companies that they seem to have very close ties with. So, there might be something in it for those who want to make a lot of profits off of this. So I think there's that piece of it. And electorally, it's a risk for sure. We've, a strange place with our politics here. But if you break it fast enough and bring these companies in fast enough, then it may not matter the result of the next election. They may have achieved their goal of getting rid of single payer Canadian Medicare by doing this. But really, it's about profit. The goal is profit, and there's close connections between some of our politicians in Canada and those who want to make a lot of money.
Another point to make, and I think you were the one who told me this, that they have rolled back decisions to privatize. They privatized diagnostic testing in Alberta, and then they realized that was a disaster, and they've changed their position on it. So it is possible to stop them in their tracks, or at least get them to roll back to some extent anyway.
Yeah.
Absolutely, and I think what we saw with the $100 million plus boondoggle with lab privatization in Alberta. My research colleague at Parkland Institute, Rebecca Graff McRae, has done some excellent work on this topic. I encourage folks to check it out. I mean, this is a government that has a pattern of pursuing these very, very costly privatization misadventures that completely erode public access to the healthcare services they need in a timely manner. They are more expensive, and at the end of the day, they fragment and leave the healthcare system in a worse state than it began. So I think there's a clear pattern here. I think the other point to keep in mind is when we look at the public opinion polling, we see that healthcare is one of the top 3 issues in Alberta. And as this government has overseen its clear deterioration, this government is increasingly vulnerable. So I think it's really important to keep in mind that we need to see governments working with the evidence, using the evidence, and if not, that public opinion is going to come back to bite. And I think that's what we're seeing. We're also seeing this in Ontario. Governments that are engaging in privatization of public healthcare services and policies that are not evidence-based, these are not popular directions. And so, public opinion will, at the end of the day, come back to bite them.
On that note, I wonder if we should go to the breakout rooms. Nick, is this time to do
Sure.
that?
Could I ask one question? I just spotted
Yeah,
that
absolutely. Yeah, we
there's
still have a
many
lot.
that we're going to miss, unfortunately, with the time we have. But there's just one seeming important. Someone asking, can we have a list of the players lining up to privatize healthcare, including the kleptocrats involved? Yeah, if who are the bad guys, who are the villains behind this? Because I think the Smith government is obviously one, but not the only one.
So this is the cui bono, who benefits question. So would you want to jump in on that, Andy or Chris?
I mean, I'd say very quickly, this is a bill that has been written for the private health insurance industry. We have on the public record them uh, showing extreme excitement about the fact that they have been involved in the implementation of this legislation through a working group. So this is the industry that should be the one that's being regulated is it appears intimately involved with government behind the scenes in its implementation. And I think this is the kind of behavior that we can come to expect, like we see in the United States, where the private health insurance and the broader private for-profit healthcare industry in the United States is, if not the most significant lobbying force in the United States, it is one of the top two. And so we need to keep these for-profit interests out because they, at the end of the day, they do not serve the public interest.
Do you want to add something, Chris?
No, that was very concise.
And I
Thank you.
request the permission to ask a question.
Okay, so I think what we're going to do now is send the person whose voice we just heard and others who want to discuss this further into the breakout rooms now. So I'll let Nick direct people at this point. I just want to say a heartfelt thank you to Andrew Longhurst of the Canadian Centre for Policy Alternatives and to Chris Gallaway of the Friends of Medicare in Alberta. We love you guys. You're doing such great work. It's such a pleasure to talk to you and hear from you, and so clear and so incisive. It's just a gift, really. And there's lots of people applauding you accordingly in the chat. So thank you so much for being with us tonight, and all Godspeed via con Dios. We're totally behind you, and we'll talk to you again probably sooner than later.